episode of severe pain, a client says to the nurse, "The pain really frightened me. I thought I was going to die." Which statement is the most appropriate response from the nurse? I understand that pain can be a frightening experience. Explanation: the nurse's most appropriate response is to acknowledge and validate the client's concerns. Questioning the client's fears is not a therapeutic response and can make the client feel defensive. False reassurance that the client should not be afraid disregards the client's fears and does not promote further communication between the client and the nurse. Dismissing the client's feelings and telling the client to relax do not encourage sharing of feeling. During a disaster, the nurse triages a victim with a fractured wrist. Which color triage tag should the nurse apply? A green triage tag, priority 3, or minimal, indicates injuries that are minor, and treatment can be delayed hours to days. A red triage tag, priority 1, or immediate, indicates injuries that are life-threatening but survivable with minimal intervention. A yellow triage tag, priority 2, or delayed, indicates injuries that are significant and require medical care, but they can wait hours without threat to life or limb. A black triage tag, priority 4, or expectant, indicates injuries that are extensive. Chances of survival are unlikely even with definitive care. Several patients that have been involved in a bombing are unlikely to survive. What triage tag color are these patients given during triage? Triage category, expectant, is priority 4, black, and applies to patients with injuries that are extensive and whose chances of survival are unlikely even with definitive care, such as unresponsive patients with penetrating head wounds, high spinal cord injuries, and wounds involving multiple anatomic sites and organs. According to the U.S. Department of Homeland Security, what are indications of bioterrorism? Select all that apply. Atypical incidence of illness for the time of year: higher numbers of people seeking health care, clusters of sick people from a shared location. Explanation: the U.S. government has identified several key indications of bioterrorism to assist in its identification. These include high outbreak of similar symptoms among previously healthy people, increased numbers of sick people seeking health care, atypical incidence of illness for the time of year and geographic location, clusters of sick people from a shared locale, unusual mortality rates among people following a brief illness, and unexplained deaths or illness among domestic and wild animals. Clients involved in a mass casualty incident are triaged and assigned a color-coded tag. When prioritizing care, Clients tagged with which color would be treated first? Clients who are tagged red require immediate care. These would be followed by clients who are tagged yellow and then green. Clients who are tagged black receive comfort measures. The nurse is triaging people that have been involved in a bus accident. A triaged patient with psychological disturbances would be tagged with which color? Triage category minimal is coded green and includes injuries that are minor and for which treatment can be delayed hours to days, such as psychological disturbances. An apartment fire spreads to 7 apartment units. Victims suffer burns, minor injuries, and broken bones from jumping from windows. Which client should be transported first? The man with respiratory distress and coughing should be transported first because he is probably experiencing smoke inhalation. The pregnant woman is not in imminent danger or likely to have a precipitous birth. The 10-year-old is not at risk for infection and could be treated in an outpatient facility. First-degree burns are considered less urgent. A client has been exposed to an inhaled anthrax. When providing care to this client, which of the following would be necessary for the nurse to follow? Standard precautions are used when providing care to clients with anthrax because the agent is not contagious through human-to-human contact. Other precautions such as droplet, airborne, or contact precautions are not necessary. The nurse is reviewing information from a recent disaster management training session. The nurse knows that all of the following activities are part of the preparedness phase of disaster management except for the preparedness phase of disaster management is the phase of planning for saving lives. Preparedness would include conducting training and mock disaster response drills, as well as designating location of shelters and developing early warning systems and evacuation routes. Providing emergency care is an aspect of the response phase. The purpose of the response phase is to limit injuries and deaths as well as reduce property damage. A triaged patient with a significant injury that can wait several hours for treatment would be assigned what priority? Triage category, delayed, is priority 2, yellow, and includes injuries that are significant and require medical care but can wait hours without threat to life or limb, such as stable abdominal wounds without evidence of significant hemorrhage, soft tissue injuries, and maxillofacial wounds without airway compromise.